Okay, so a review of the lymphatic system. So I've just been saying that I won't be able to do any marvelous drawings because I'm just doing a Q&A here. But it might be that I do another recording with some marvelous drawings on my whiteboard as a sort of supplement to this as well. So watch this space. But let's begin, first of all, by saying there's lots of things to introduce when talking about the lymphatic system. First of all, the lymphatic system is the immune system. Now, look, I'm not an immunologist. Immunology is a huge subject, and I'm not an immunologist. I love the lymphatic system. I talk about it a lot, and what we know, or what we need to know, is enough to make sure that we are able to support our patients and our clients with good immune system, and point them in the directions of how to boost the immune system and what we can do to support immune system. But if I was to get somebody with an autoimmune situation or an immune condition that I didn't know, then I would point them in the direction of they would be under consultants anyway. But for example, boosting immune system, manual lymphatic drainage, working with facial lymphatics, and generally having a good immune system is very much what we can help and support our clients and patients with. So first of all, what we need to know is that if you imagine the circulatory system and the blood that flows everywhere from the heart and around the body and back to the heart and to the lungs and back to the heart and around the body, alongside our cardiovascular system or circulatory system, we have our lymphatic system. And the lymphatic system is part of the circulatory system. So it's considered that circulatory representation, in that it runs alongside the blood. And let me just set it up. So that's what it's part of the circulatory system, but it doesn't have a pump. So unlike the heart unlike the blood that has the heart to pump around the body, the lymphatic system doesn't have that pump. It relies on skeletal movement, i.e. exercise, walking, massage, skin brushing, gua sha, and just general movement. It does have a certain amount of pressure, inertia that moves it, so that if you are very sedentary, you still will have a lymphatic system that moves around. But the more you can assist your lymphatic system to move, the better. Now, the lymphatic system and the lymphatic vessels lie within the skin, so quite superficial, in fact. And so often, you will experience lymphatics as ones where you can feel and palpate, or work with skin brushing or massage, or work with movement, and it be very effective, in fact. So the other thing about the lymphatic system is that it has what's called fine blind-ended tubes. And these fine blind-ended tubes are almost a little bit like villi, which we were talking about previously in the previous video when we talked about the digestive system. It has these fine blind-ended tubes along its vessels that pick up the interstitial fluid. I'll talk about that in a second. So what the next thing to know is that the lymphatic system has two jobs. The first job is to drain excess tissue fluid. And if you remember my image of the bath, is that you have a bath and you fill it up, and that if you were to keep filling it up, we have a plug next to the tap that we call like an overflow that will take any fluid, excess water out, and so it won't overflow. Now, if that plug, either you didn't have one of those plugs, or let's say you did have a plug, but it was blocked, or it didn't work very well, and the bath fluid kept filling and filling and filling, eventually it would overflow, and you'd get you'd get a flood, this overflowing and flooding. So what we have with the lymphatic system is this overflow system that picks up excess tissue fluid. Now, when we talk about tissue fluid or interstitial fluid is a derivative. It comes from the bloodstream. So if you remember, goodness, the blood is made up of 75% of water fluids, plus it's made up of an opaque fluid called plasma, which is a protein, and then all the other goodies, the enzymes, the hormones, and everything that's made up, and the waste and gases and everything within the blood. But if we're considering the amount of water and a little bit of plasma within the blood, this fluid, if it's too much and it fills up the vessels, the blood vessels, and it possibly will, and it does, it then secretes or seeps through a capillary level throughout the body, and that where it's going to various places. So if we remember that we have arteries, which is not permeable, which are thick, carrying blood. We have arterioles, which are a little bit thinner and allow blood flow to go a bit faster. And then they arise, they become capillaries. And it's at capillary level that all the particles and the compositions of blood, be it hormones, gases, enzymes, waste, carbon dioxide, oxygen, moves in and out of the vessels, of the blood vessels. And it's at this point, any excess tissue fluid moves out of the vessels, and they bathe then in what's called the tissue space. And the tissue space is within the body, around the cells, around the organs. And it's not sloshing, because there's a lot of stuff. If you can imagine the body with its bones and muscles and organs, it's not like there's loads of space, but there's space where this interstitial fluid bathes. Now, what happens there is that so that it's moving and being drained and not pooling in the interstitial space, is that it will be picked up by the lymphatic system through these fine blind-ended tubes that goes, oh yes, come into my channel. We've got plenty of room. And in it goes into the interstitial fluid, moves into the permeable, fine blind-ended tubes that are permeable, that pick up the lymph and put it into the lymph vessel. So it's now in a new tube called the lymphatic system, or the lymphatic vessels, and it's an opaque, watery, coloured fluid that now what we need to do is move it through so that it goes on its own journey and it doesn't pool. Because if it pools, we then get puffiness. And you know puffiness because puffiness a little bit under the eyes, and puffiness a little bit here, puffiness around the hands and the wrists, puffiness, a lot of puffiness around the ankles, around the knees. And what we don't want is puffiness. So we want the lymphatic system to move it round and move it and keep it moving. Now, what also reduces puffiness, by the way, is the flow of blood into the kidneys and passing urine. Also, that's how we lose water as well. So we're losing water that way as well. So we're not just retaining water, because if you retain water, you can get puffiness and what's called oedema that way as well. So you can get fluid retention, which is water, which means that the kidneys aren't passing out enough water. So that's another way that we can get puffy. But this puffiness that is lymph can also get a little bit hardened and a little bit pulled and stuck a little bit. And that's when you're getting these sort of, stubborn, puffy areas. So encouraging the lymphatic system to keep moving and moving through its system, it requires assistance. Now, the second job, which is a really important job, which is when we're talking about immunology in a way, is that the immune system will also the lymphatic system, immune system, will also take care of any harmful pathogens. And we're talking about harmful pathogens and bacteria and virus here. We're not talking about drugs and alcohol, because the liver destroys and takes care of that. And that will also be engulfed and destroyed and metabolized in through the liver. But this is our harmful pathogens, bacteria, viruses, and what we pick up just out and about. And when people carrying viruses sneeze in your face, you're picking up door handles and tubes and on the trains and etc. and fighting it like grazes, like little grazes and little cuts and wounds and that aspect. And this is where the lymphatic system is really very interesting, is that what happens, and also this lymph fluid aids the transportation to the sites where they get engulfed and destroyed, or fought, if you like, the fighting of infection. Is that when you pick up either through the respiratory system, through ingesting any food that's got any harmful pathogens, if you've eaten some shellfish perhaps and it's got a little bit of bacteria, or you sort of have bacteria on your hands and then you're eating, or you're ingesting, or you've kissed somebody with a virus, or airborne, or bacterias and pollutants through the respiratory system, and also perhaps toxins through applying through the skin, any toxins, microplastics, inhalations, absorptions. The bloodstream goes, your name's not down, you're not coming in. The bloodstream does not like harmful bacteria or viruses of any nature. And the bloodstream will go, right, at the next capillary, you're out. And at the next capillary, you're out. And the immune system goes, oh, we'll have you. And so the interstitial fluid will take on these harmful pathogens, and then it goes, okay, let's get you into the lymphatic system. So you go into the lymphatic system, and you're going to head in this now excess tissue fluid, this lymph, will transport you to your nearest node. Now, if you remember the nearest nodes, or not the nearest nodes, the nodes are briefly in front of the ears, behind the ears, under the jawline, under the chin, in the neck, under the armpit, in the crease of the elbow, in the inguinal groin area, and at the back of the back. This is not me being this is a brown coloured top. This is not me being Gen Z. This is actually a brown coloured top, or behind your behind your knees, the popliteal spaces, and there's nodes there. Now these nodes. Inside the node, we've got specialised groups of cells called macrophages, phagocytes, lymphocytes, white blood cells, leukocytes, white blood cells. And these guys inside here are like little Pac-Men, and in comes the lymph, a little bit like a Brita filter. In comes the lymph, and the filter inside it, these guys, these specialised macrophages, these specialised cells, engulf and destroy, fight infection, produce antibodies. So some of them, they just like wipe out, just literally wipe out. Some of them like, oh, we'll just fight you, fight this infection for you, and just, they'll fight for you. Some are like, oh, well, we've seen you before, we don't mind you, yeah, we've got some antibodies, we recognise you. And that's things like, immunization, is that, sometimes you can have a cold and you don't catch every cold. Unless you've got a very low immune system, and we'll talk about that in a second, because if you've got a very low immune system, these guys they're not very strong, they're a bit weak. And because what you want some really strong guys in there that are just like, God, did you just sneeze? Oh, God. But often there are strands of viruses, and we know about strands of viruses, don't we? That they're really powerful and they're really strong, and basically you don't have a chance. So once these guys have done their job, and if they need to send you to bed for a week or 3 days and poorly and lie on your sofa for 3 days, they will do that, and they will elevate, they will send a lot of blood everywhere, give you a fever, get a lot of white blood cells reproducing, do their work, and they will boost your immune system. So actually, when you are poorly, it is boosting your immune system massively. It's like it's almost like doing a Control-Alt-Delete reset. And sometimes they do a whole factory reset if you've got something really bad. But sometimes it's just literally like rebooting. And it's quite good to reboot, actually. So next time you do have a flu or a cold, it just go, oh, great, I'm going to go to bed for 3 days and let my body reboot itself. Let's do a little upgrade while you're at it. I'll have a new operating system, thank you very much. And so we boost our immune system. Now, ways to boost our immune system. Oh, let me just finish the journey, the voyage. I'm going to use that word from now on. The voyage of our lymph, as it's been neutralized, then it leaves the node, and it's heading towards, if it's the lower body, this one's really cool to know, is that if it's the lower body, we have what's called the cisterna chyli, and the cisterna chyli gathers all the lymph from the lower legs and the lower body, and it gathers from the inguinal nodes here at the groin, and then it works its way into this vessel that has this sort of lovely convoluted shape with valves so that it doesn't flow backwards, and it makes its way up this vessel called the cisterna chyli, and the cisterna chyli travels all the way up to the root of the neck, and then all the lymph from the top of the body and the arms, one arm, travels into what's called the thoracic ducts. Okay, and the thoracic ducts is the collecting place, or the collecting tubes of all this filtered and cleansed and clean lymph, and no more virus or bacterias, and tips into the subclavian vein, which is subclavian, underneath the clavicle. So from the thoracic ducts into the subclavian vein, and then they join the superior vena cava in that main vein that comes back into the heart, into the right atrium, and then it returns as blood. So it's actually returned to blood as soon as it enters into the subclavian vein. It returns as blood, as fluid, back to plasma and water within the bloodstream. So that is circulating the whole time. The blood, fluid, interstitial fluid, lymph, back up, blood. And then as we know that by the end of 120 days, our blood cells are renewed they renewed all the time, and every blood cell that's spent its time of 120 days will then exit through our bowel as poo. And so we're sort of replenishing the blood, replenishing that whole process. The kidney is filtering blood all the time with the water component and getting rid of proteinuria. So these are incredible systems of filtration and elimination of waste. And as long as we look after ourselves, it will do us very, very well. And things like skin brushing, I've talked about skin brushing before. Skin brushing, massage, walking, just 30 minutes of walking every day will keep your lymph moving. Because if you don't and you get a sluggish, you will get puffiness, swollen, puffy ankles, wrists, face, neck, and internally as well. And then also your immune system will be compromised and lowered. We don't want that. And then you're sort of susceptible to coughs and colds and poorliness. Ways to boost your immune system: diet, nutrition. You could Google ways to boost my immune system. It's all those sort of things that we said that boost vagus nerve as well. So, really getting your immunity up. Good nutrition, blueberries, ginger, turmeric, all of these are anti-inflammatory and immune boosting. So looking at ways to immune with nature, with nutrition, with essential oils, with supplements, and daily lifestyle choices, and just trying to sort of stay out of harm's way. That is the lymphatic system. I think that's everything. I mean, there's loads more, because there's things like you could look up and you could look at the immune response or the inflammatory response and immunology in a big way, like all the different cells that we've got immune system even within the skin, so that when we put products on that are toxic within the skin, there are macrophages and specialized cells that are going, oh, let's engulf and destroy you. So it's quite a spectacular field. So any questions on that?
Just with the skin brushing?
Yeah.
Is once a week okay? Or like, how often would you do it?
That's a great question. I mean, for me, I do. So I don't do it every time I get in the shower. I don't. I think, once a week is okay. Once a week is really good. You don't need to be doing it every day if you've got an active lifestyle. But say, for example, you've got a situation where you're wanting to work on your lymphatic system and you want to work on lymphatic drainage, then I would target it every day. If I'm trying to really improve my lymphatic system, I'm going to work with my gua sha and my brushing. I think I've showed you my brushes, and let's get a piece of gua sha just very quickly. So, depending on if I'm trying to, improve and sculpt and drain, then I'll be brushing. You can brush towards these nodes, and say, for example, I feel that this is really puffy, I can sort of do some nice circles and circles. And because the lymphatic system lies within the skin, this just sort of beautifully picks it up. Whereas when you're massaging, this is another thing that's really interesting to tell you, is that when you're working with the lymphatic vessels, they're almost like, if you imagine vermicelli or linguine, and they're little tiny vessels with fluid, but they collapse and then they open again. So if I show you just like a large example, is that it would collapse and then open again, a bit like a straw or a rubber tube. Now, if I was doing this, trying to sort of do my lymphatics, I'm actually flattening it. Do you know what I mean? So I'm actually here, I'm not doing it very much favour, because if I'm pressing hard, I'm flattening it. Whereas what you want to do is almost like brush it so that it doesn't, so you're moving it so that you're allowing it to undulate, the fluid to undulate, rather than flatten and open. So the flattening and opening does move it. It still allows movement. But if you're sort of brushing it and gathering it and brushing the vessels and helping the vessels in this way, you have a more effective way of moving lymph. So if I was to brush every day, doing this every single day, I would certainly start to see good results. Now, if I do it once a week, it's good. It's super helpful. It's super helpful. But if I did this every day, I would definitely see more of a jawline, for example, because this, although there's sort of an aspect of fat cells, perhaps, there's also quite a lot of lymph here, because there's so many lymph nodes here. So if I'm brushing towards the thoracic ducts, yeah, and here, and I do this regularly and regularly, and then also use very light gua sha strokes, really light, because if I go really heavy like that, I'm flattening them. So if I want to get lymph from under my eye, I don't want to do that because I'm flattening it, I'm squashing them. So I'm almost just pumping. In fact, better than that is brushing. So brushing, can you see that it has a very, very effective way of draining? So if you've got puffy under eyes, you want to be brushing. Where's my amazing brush? Here it is. Because I do this all the time. So I do it regularly. I do this regularly because I do get a little bit puffy. So I've got brushes that are specifically working, and then I'm going to brush towards these pre-auricular nodes. And then I'm using this brush to brush down. And sometimes, sometimes it's really stubborn and sometimes it can get quite solid. And that's why you just need to keep doing it. So I'd say once a week, a full skin brush is excellent for a full skin brush, like, up your thighs, up, up, up. And you want to be brushing towards the cisterna chyli, in fact, forwards and forwards and forwards and forwards and up and up and up and up and up and up. And then what you want to do is pump the thoracic ducts, just sit very, very quiet, not quietly, but gently. So you're not going like, you're not doing that. That's not it. So just gently pumping here at the thoracic ducts is very, very, very good for your lymphatic drainage. Can you see my sculpted jaw? But as we get older, the lymphatic system slows down a little bit, as does everything slow down a little bit. So we need to give it really good help. So yeah, regular skin brushing is brilliant. Regular exercise is excellent. Regular massage is the best because you get somebody to do it for you. Regular manual lymphatic drainage massage is awesome because they literally do a full body drainage massage for you. It's super light with brushing and light techniques. So, thank you. What a great question.